My name is Dr. Julia Schmidt, and I lead the Cedar Brain Injury Lab. Our lab is based at GF Strong Rehabilitation Centre and affiliated with the University of British Columbia in Vancouver. Our lab partners with people with brain injury, community associations, healthcare providers, and policymakers. We want to understand the experience of brain injury to develop programs to support quality of life and personally meaningful goals after brain injury. So many people with brain injury also have concurrent conditions, such as mental health issues or substance use concerns. In order to investigate this issue, we partnered with people with brain injury and concurrent conditions, community associations, policymakers, clinicians, and researchers from across British Columbia. We aim to investigate the facilitators and barriers of healthcare service provision for brain injury and concurrent conditions. Findings from our study identified recommendations to improve the accessibility and quality of brain injury healthcare services.
It is estimated that more than 60% of people with an acquired brain injury also struggle with concurrent mental health or substance use disorders. People with concurrent brain injury and mental health disorders and substance use have unique treatment needs that are not met effectively by the current healthcare system because of the limited communication and coordination between the available healthcare services and service providers. This results in increased burden on patients to self-advocate for their needs and seek out services in order to actually receive the support needed. One possible way to mitigate this is through integrated healthcare services, where a person can access a variety of services within one integrated system. The purpose of the present study was to engage key stakeholders to identify barriers and facilitators to healthcare service delivery for people with concurrent brain injury, mental health, or substance use concerns in British Columbia. We hosted a day-long event where people with brain injury, caregivers, healthcare professionals, and policymakers could discuss the existing healthcare services within a focus group setting. A total of 90 participants provided their unique perspectives and input based on experiences and expertise. Overall, the barriers and facilitators that were generated fell into three main categories: the complexity of brain injury, the supports, and the structure of care. Let's dive a little deeper. The category complexity of brain injury outlined the ongoing basic needs after brain injury and highlighted the need for public awareness of brain injury. Barriers to accessing basic needs included lack of long-term financial support, system-level issues with accessing safe and affordable housing, and a lack of housing specialized to meet the needs of people with brain injury and concurrent mental health or substance use concerns. Additionally, there is an emphasis on the need for better public awareness and education on the complexity of brain injury symptoms and concurrent issues, as this can impact people's behavior towards people with brain injury, especially when the injury is not visible. For instance, several participants described how they experience a lack of acknowledgement of long-term issues, as brain injury is often thought to be a short-term condition. Other participants noted that although some education on brain injury has improved, there is still stigma that needs to be addressed through advocacy programs and education programs for the public on the occurrence of concurrent issues. The second category, supports, outlined healthcare professional support and community-based supports. Participants emphasized the need for healthcare and professional supports to be more accessible and more knowledgeable about the concurrent conditions of brain injury. Many participants described the need for receiving a diagnosis in order to actually be allowed to access certain resources like funding, and this was hard to get as there is a lack of family doctors and other professionals don't have training to adequately diagnose a brain injury. Participants also emphasized the need for community-based support, especially during the transition from hospital to home. Participants described how home-based support and case managers who can help address concurrent concerns during rehabilitation are essential, and that there is a need for collaboration between community organizations and resources in order to get assistance with navigating services. Overall, participants stated that they just need to be seen as a human beyond just their injury. Finally, the last category, structure of care, described people with brain injury needing to meet criteria for support, experiences of navigating through the system, and necessity of integrated services. Participants noted how system-level barriers exist that prevent people from brain injury from getting needed support. For instance, being turned away at hospitals or needing a diagnosis or referrals to access timely support. This was especially important for those requiring specialized support for concurrent issues. Participants also highlighted the importance of support available and how there was simply not enough specialized supports available. Even if they were available, a major barrier to accessing them was a lack of knowledge of these resources by healthcare professionals, leading them to be lost. Navigational support is not a priority for many systems, and this needs to be improved for resources to be accessible to those who need it. Overall, there seemed to be a disconnect in the system, resulting in a lack of proper support for people struggling with brain injury and concurrent issues. Additionally, participants described a need for continuous and integrated services, where a person with brain injury could be supported through the healthcare system without having to navigate separated forms of care alone. Participants suggested creating a targeted pathway could prevent the need for repeating information between healthcare providers and emphasize the role of certain specialized programs, such as mental health services and legal services, along that pathway. In summary, the study highlights the facilitators and barriers of healthcare services for brain injury and concurrent conditions and provides insights into the changes that may be needed. We hope these findings can help improve the accessibility and quality of brain injury healthcare services.
Thank you for your interest. For more information and updates of our lab, find us online and on LinkedIn at Cedar Brain Injury Lab.